So the next question is, can diabetic patients stop taking medications, supplements, or insulin? If you think that yes, diabetic patient can stop taking medication, okay, you can write yes for 7, okay. If you think it's yes, then you type 7. If you think it's no, then write 8. Right? Can diabetic patients stop taking medication, supplements, or insulin?
What have you been told by your doctors? Right. Okay.
Once you're diagnosed with diabetes, can you really stop them? Or you need to take it for the rest of your life? Yeah, I don't, maybe not only diabetes, lah. Hypertension also applies.
Also, correct.
Hypertension also applies.
Okay, let's move on. Okay, so are we the first doctors in the whole world to come to know about this first? No, not really. We are also just a bunch of copycats. Okay. All right. What happened was I'm being inspired by this lady. Okay, her name is Dr. Sarah Horberg from the US. I stumbled across her this TED Talk. Okay, on YouTube. I love to watch TED Talk is because my passion is public speaking is my passion, and I love to watch these professional public speakers speak. You know, and I learn from them. And so, if you're wondering how come we are good in terms of delivering messages, is because we are actually trained to do it. Okay, we are trained to simplify complicated medical knowledge. Okay, come. So it was written here: reverse diabetes by ignoring the guidelines. So the first time I heard about this was like, wow, this is a very daring and a very bold statement, you know. And I never learned this in medical school. My parents pay a few $100,000s for me to do my medicine, and I never learned this. Even my senior in the hospitals and the government never taught me about this. They told me diabetes is a lifelong disease, chronic disease. You have to take lifelong medication. So when I first came across this, I was very doubtful. So ladies and gentlemen, I understand how you feel, because exactly this is how I felt about 4 or 5 years ago when I first watched this. So if this is the first time you came across this concept of reversing diabetes, I understand how you feel completely. Don't worry about it, okay? All right, but I need you to stay open, because by staying open, you might just save your life, okay? And of course, the next doctor that inspired me is Dr. Jason Fung. So Dr. Jason Fung is a Canadian nephrologist. Okay, so why is a nephrologist doing in this field of reversing diabetes? Okay, you probably already know why. I already mentioned just now, about 70% of the kidney failure patients are due to diabetes. So he is a kidney specialist. And in his career, he has seen so many kidney failure patients. By the time they go and see him, it's too late. So he couldn't do anything. So he was trying to search for the root cause, and he found, oh, diabetes and hypertension is the root cause. Then from there, he was like, hey, how come these people who are taking medication, insulin, in the end, why are they still suffering from kidney failure? So he dig very deep into all these conditions, and then that's how he found out about the root cause. And of course, now he's a leading expert when it comes to reversing diabetes, and I'm very thankful to him because I've learned a great deal from him. Okay, let's move on to the next one. So we have someone from the US, we have someone from the Canada. What about Malaysia? Are there any doctors in Malaysia other than the two of us here, Dr. Andrew and and of course, and Dr. Jasmine? Are we the only one who is talking about this? Who is this guy here? Okay, who is this guy? Can someone tell me who is this guy? Okay, this superhero of ours, okay, who has been, tirelessly helping our country to handle this COVID-19 pandemic. Okay, can someone guess who is this? Okay, we just need to have one answer, then we can actually move on. But I think we have to really pay our due respect to this superhero of ours, and he was also being awarded as the top 3 best doctors in the world when it comes to handling this pandemic. Okay, all right. Okay, I think due to time factor, I think we just move on. Okay, probably the answer will come in later. Okay, so pretty sure you all know who is this guy. Okay, so he is none other than Dr. Tan Sri Dr. Hisham Abdullah. Okay, let's take a look at what he actually wrote here. Individuals with diabetes are more likely to develop a more severe form of COVID-19. He said that, we didn't say that. The virus does not discriminate who it infects, include those with non-communicable diseases such as diabetes. Of course, it also includes hypertension and also obesity. And I'm not sure how many of you realize, right? Among the death cases, you notice that most of these patients are actually diabetic. Just take a look at this. This is in Bahasa Melayu, of course. Kencing manis. The next one is kencing manis. Okay, the death case number 533, kencing manis. Kencing manis. The whole list is all kencing manis. Do you even think that if you are taking medications, and insulin for your condition, and if you happen to get so unluckily you actually got this infected with COVID-19, you think your chances of surviving is high? Or do you think only by reversing the condition, then only your chances are higher? So I need you to really think about it. Okay. All right. So let's move on. We also want to see what exactly he mentioned in his Facebook a couple of years ago. Okay. It's Tan Sri Dr. Hisham Abdullah, our DG. Not impossible means possible. That type 2 diabetes can be reversed. He said that and cured in just 4 months by cutting calories, exercising, and keeping glucose under control. A trial has shown. Right. Okay, let's move on. Okay, so if you're thinking that, some people will be thinking, are you sure can or not? We are Malaysia's #1 and the largest reversing diabetes center. And the patients with the longest diabetes is up to 36 years. Look at this patient, Mr. Leong Kyun Sin, 74 years old Chinese gentleman. He is a diabetic since 1984, the year I was born. Yeah, I'm only 36 year young, okay? Okay, and he was on 98 units of insulin. Do you know that it only took us 4 months to reverse his condition? 4 good months. 4 good months to get rid of all this insulin. And ladies and gentlemen, for information, as of today, he is no more on insulin and his blood sugar is within good control. How many of you think that, it's pretty awesome, to actually get rid of this insulin and yet have a good blood sugar control? If you think this is pretty awesome, please comment there yes. Okay, please comment there yes. All right. Yep. Okay, let's move on. Okay, I think at this point of time, okay, all right. Instead of we speaking continuously, we would like to invite a very special guest of ours, okay, by the name of Mr. Simon. He is a former safety and health manager, and of course, he has been embarking on the journey of reversing diabetes program with us. And I think without wasting too much time, we are going to invite him on board. Okay, so ladies and gentlemen, please welcome Mr. Simon. Hello.
Hi, Dr. Andrew and Dr.
Hi,
Yasir.
Mr. Simon. Yes.
Thank you. Thank you for putting me on board.
Yes. Thank you so much for spending your Monday night with us.
No issue. I can be any help. Sure, I will do.
Okay. All right. Okay. So probably share with us. Obviously you are diabetic. Since when you have been diabetic? Which year? Can you recall?
I was diagnosed in 2017. Is by chance.
What do you
By,
mean by chance? Sorry.
because I was supposed to apply for something and I need a medical checkup and they check my
Oh.
urine and
Okay.
they say there's protein there. And then
Oh.
the doctor so happened to be my uncle's daughter, and she said, "Uncle, better you go for a blood test tomorrow, fasting glucose." So next day I
Okay.
went for HbA1c, and
Yes.
it was confirmed it was 9.2. I think it was 9.2. I think
Wow.
going back to the symptoms, what she mentioned, it has been there for 2-3 years, but I've been doing a yearly checkup with
Yeah.
a doctor in a hospital, different hospital. I wish not to mention here, but
Yes.
I was taking HB1AC for the past every year, so there's a record for a few years, but
Yeah.
never he mentioned that you are diabetes control or nothing. You're fine,
Okay.
you're fine. So after that, I was straight away put on metformin twice a day,
Yeah.
and I used to check. They did say check your blood to test, but I used to do my own reading
Yes.
every few days once, 2 days once, and it don't seems to be going down very low. It is just like always about 7, within 7 to 8.
Your
That's
fasting blood sugar.
fasting blood sugar.
Yes.
And,
Okay. Okay.
on top of that, I also uh, cut down on the sugar. Not completely, not zero sugar. Zero, I still take teh tarik korang manis,
Yeah.
and then other things I eat normal carbo and all those things. But cut down on the carbo also. It's not that full scale like last time.
Yeah.
So it was never going down. It was always
Okay.
there. So since then, my doctor says, okay, you still quite control, but you try to control, try to be, careful on your food and all this thing. That's the only advice I get lah.
From your doctor.
from a doctor.
Yes. Okay.
But then when I come, I the chance to the Facebook, I saw reversing by reverse it because I quickly grabbed the chance and listened to Dr. Andrew and Dr. Yasmin, and I made an appointment with Dr. Andrew to see him personally. That was on the 8th December. I saw him, and at that
Uh-huh.
time, when I see Dr. Andrew, my blood test was done 2 months before. That was October 2020. My
Mm.
HbA1c was 7.2,
Yep.
7.2, and then my weight was about 76.4 kg, I think.
Yeah, you're
So,
right.
so with the advice and guidance, Dr. Andrew, I started my journey to reverse my diabetes on the 9th December itself. And
Uh-huh.
after about 3 weeks, I went back to see him. I am
Yes.
still on metformin. I still on metformin. Not only metformin, with 10 other drugs for my heart patient because I was also a heart patient.
10 other drugs.
10 other drugs.
Okay.
And not forgetting, I'm a single kidney patient. My kidney, I'm born with one kidney. So
Okay.
I'm very, very well aware because this diabetes is very dangerous for, if you don't take care, don't not treat it properly, your kidney will be affected.
Yep,
So I'm
that's right.
well aware of that way before. So that's why I just jumped quickly and I started my journey. And after 20 days, my sugar level with the diet control, all this discipline myself. And I remember this word Dr. Andrew said, no cheating. Diet. Okay, that's very important. That's very important when you start your journey in reversing diabetes. And my most of the time it come down to below six.
Okay.
Below six, my reading always below six most of the time.
All right.
Okay, and then I was still on drugs, on medication metformin. Then the second session after almost a month, that was January 26th. But in
Mm-mm.
the second section itself, Dr. Andrew already cut down about 3 or 4 medications. Medication I cut down after that. The second session itself, metformin is out, and it is now always within the range of six, average six, without medication, and cutting down all the blood pressure medication and all this. So I'm only now, let's say for my heart and generally overall medication, I only about five now. So
I'm looking at your sister your record now. You are currently on one, two, three. You're on four medications now at
four
this moment.
medications, right? Yeah, the
Yeah.
one of it is twice a day. The size is five.
Oh,
It's
yeah,
four.
yeah, yeah.
It's
You're right.
four.
You're
Yeah,
right.
right.
Yes, yes, yes.
So it's
Wastara is
four now.
twice a day. Yeah.
Yeah,
Correct. Yeah.
metformin is also out totally.
Yeah. Metformin is out. Yeah.
Yeah, my blood pressure, cholesterol, all are out.
Yeah.
I feel very, very energetic. I feel very good, and I don't go. I just listen these guys. I don't go to night toilets as often as I used to.
How
I,
often you go to last time? I mean, before you met
last
us.
time at least 3 to 4 times.
Are you serious?
Yes.
Wow.
Now two
Jasmine,
is
you're muted.
two is maximum. Two is maximum.
Two
Oh,
is maximum.
reduced already lah.
Yeah,
Right, right, right.
reduce.
Okay.
And my numbness, my legs all way go down already. I don't feel so much.
Can you share
Wow.
with us a little bit more about your numbness?
Numbness
Because
I used
actually,
to
I
have
remember
like it was a daily affair, everything there like a burning sensation, my both legs, more towards
both
on the
legs
left
are
leg.
left.
Both legs, but more towards on the left. I always check my legs, is there anything wrong, But I know it's related to diabetes, lah. But I always
Yeah.
check, make sure that I won't get any wound, my skin won't get darker and all those things.
Yes,
I
yes.
wash my legs properly during all my baths. And then after this diet change and everything, I remember telling doctor my numbness all gone. I should say about 50 to 60% or 70% gone, and I don't feel it every day now.
Fantastic.
Yeah. I
Ladies
don't
and
believe.
gentlemen, how many of you think that this is pretty awesome, for this numbness to disappear up to like 60 to 70% just in about a month plus, I think, right?
Yeah, month plus, yes.
Yeah, 1 month plus. If you think this is awesome and you would like to be like Simon, yeah, please put there, please comment why and let us know that you're also keen, or interested with this kind of, improvement as well. Yep.
Yeah. So it's very worthwhile. Worthwhile. You will be very happy. See. When you're happy, I'm very sure all your organs also will be happy. Yeah. Okay.
Yes,
So
you are so
no
right.
stress. No stress. Okay. Because sometimes
Yes.
stress plays a part.
Yeah,
Yeah.
yeah,
Yeah.
yeah,
So I'm very happy on my way. And when I started the journey, I was, as I told you, 76.4 kg.
yep.
Now I am. This morning I mentioned it. No, it's this morning it was 70 kg.
Are you
So
serious? 70 so
yes,
fast?
yes.
Wow.
Because last week when I saw you, Dr. Andrew, it was 71 or something. Now it's
72.
70.
You told me 72 when I saw you
72.
last week. Yeah, on
Yes,
the
70,
27. You're
70
telling me
point.
you're 70 now.
Yeah.
Wow.
So that is within the span of 2 months. That's almost
Yeah,
6
correct. You
kg.
started
6
seeing me
kg.
in early
6
December.
kg. Yeah, 6 kg.
Yeah.
So I'm
Wow.
very happy.
Your
So
ideal weight is supposed to be 49 to 61. So our
yeah,
aim now is to
61.
bring you down to less than 61 kg.
Correct.
Yeah. Wow. Very soon you'll be there already.
Yeah, I'm very happy now. Thank you, Dr. Andrew, for your
Yeah.
guidance.
Thank you, Simon, for also giving us the trust on this. I'm not just was just wondering, and you have any questions for Mr. Simon? Okay, feel free to comment. Okay, yeah. Why and very curious to find out more on this is this reversing diabetes. Yes, we'll be sharing more after this. So yeah. So any more questions for okay? Maybe we can ask. I think of many people are very worried when it comes to like whenever we talk about diet plans, right? Usually people are very scared, right? You're like, ayo, this cannot eat, that cannot eat, a lot of restriction and things like that. Simon, probably you want to share with us, what do you think
I,
of the current diet plan? Is it quite liberal? Like, do you have a lot of freedom and things like that? Just let
I,
people know.
I,
Yeah.
I lost nothing. I eat better food now than last time.
You eat better food.
Yeah, I think generally for Malaysians, being
Good
Malaysians,
for you.
Asians, I think the carbohydrates are the favorite food, the tastiest food.
Yes,
Yeah,
you're
but
right. You're right.
we don't realize that they are killers. They are our killers. Not only diabetes, any other disease, carbo is very related. But I
Mm.
cut it down completely. My carbo, I'm
Yep.
much feeling much healthier and lighter. I'm
Yeah.
eating everything. I eat fat. I eat a
Yes.
lot of meat.
Yep.
Take a lot of vegetables.
Yes.
Yeah. So what's the deal? I lose nothing. In fact, I'm enjoying. In fact, I'm
You
enjoying
lose
life.
weight
Yeah, I
and
lose
your
weight.
sugar level has gone down and then your
Yeah.
BP has gone to normal. So you lose
BP.
weight lah.
Yeah. Yeah. Thanks, Doctor Jasmine, reminding me. With my medication, my blood used to be, my pressure used to 120 plus, 130 plus, over 80, 90. Now without medication, my blood pressure is nothing more than 120 and over
Wow.
80. Nothing.
Wow.
How many
Awesome.
of you
That's
think this is awesome? Like you notice Mr. Simon just mentioned that without medications, he was even doing better. How many of you think this is awesome and you would like to experience what Mr. Simon is experiencing? Please comment yes. Please comment yes. Because you can see how Simon is sharing with his heart that the joy that he has, and now without medications the BP is even lower and he's enjoying his food. Yeah.
yeah. People might be wondering how old I am. I'm 65.
You don't look like 65, Mr. Simon. Aiyo.
Thank you for the compliment. I'm 65.
Okay.
So
Okay. Right.
I'm very
Yeah.
happy. Thank
Yeah.
God. Thank God I found this program, and I'm very happy. And thank God for my wife. She prepares most of my meals. And not only that, not only me, my wife joined me in my meals. She
Oh,
does the
okay.
same. Yeah.
Okay.
Only I feel bad. Hey, depriving you your favorite food. Don't worry. I'm happy. I'm fine.
Did
So
your wife see
I
any
thank God.
improvement on her side? Like,
Yeah, she's losing weight.
oh,
She's
okay.
losing weight too, but she's not on any medication. Thank
Yeah.
God for good health for her.
Yes.
She's not on any medication. Thank God she's perfectly fine, but she's losing weight.
But was she overweight before that, or is she in a
No, no,
normal
no,
range?
no, no. She was in the somewhere in the 50s only, mid 50s.
Oh,
Yeah,
okay,
uh,
okay,
she
yeah.
is less than she is less than 4, 5 years, 4, 5 years below junior to me.
Uh-huh.
And the other day is when I mentioned when I told you 72. She also weigh. She said, "Hey, I went down before below 50." She said, so she went down too. She went
Okay,
down too.
okay, all
Yeah,
right. Is she feeling the same result as you, as in like, is she more energetic now as well?
yeah,
That
of
means more.
course. Yeah, she's
Wow.
definitely feeling good.
Okay, okay.
No, no
And
complaints.
so, okay, just share with the crowd. Did I prescribe any supplements to you in this entire journey of the for the past 2 months? Were
I
any
don't
supplements?
remember discussing about supplements or additional medication, this and that. We only discuss food. This is good. Take that. Don't take this. Don't take that. Only food. What kind
Yeah,
of food to take? What food not to take?
yeah,
This is
yeah.
no good. This is no good. That's all.
Right. That's right. That's
We
right.
don't we don't even mention organic and non-organic. It's food. Yeah.
Correct. Correct. What we really want is real natural food. Yeah.
Yes.
Yes. Yes. Yes. Yeah. Okay, that's good. That's good. All right. So, probably you want to share one word of advice to all our friends here, today, because I'm pretty sure there are a lot of patients here who are diabetic, hypertensive, and they wish to be like you. Can you give them one word of advice? Like, what would you
Okay.
advise them to do?
My experience prior to this journey, the biggest problem was food intake. It's very difficult to avoid that, avoid this, avoid this. But now, uh, I should say we must discipline ourselves. Like Jasmine said, we must shift, paradigm shift, uh, paradigm shift, discipline ourselves. These two things. You
Yeah.
change your mindset, I call it paradigm shift. Then you discipline yourself, and you will come out of it. With God willing, definitely you will come out of it.
Yeah. All
Uh,
right.
Thanks. You can call me anytime. I think in the WhatsApp group, I mean the Facebook thing. I can ask me anything, then I'll come back to you.
Yeah. Okay.
Thank, thank,
So, all right. Thank you so much, Simon, for joining us tonight. Okay. So,
thank you for having me on board also.
yeah.
Thank you so much for sharing.
Welcome, you're
Right.
welcome. Thanks.
God bless you, and we will see you soon.
Yeah. Good night.
All right.
Good
Thank
night.
you. Good
Thank you.
night.
All the best to the rest.
All right.
Please come
Thank
on
you.
board and don't say, I wouldn't say try. It definitely will work.
All
Yeah,
right.
I'm a good example.
Thank you. All right. Okay. How many of you think that what Mr. Simon experienced is pretty awesome? As in 2 months. Can you imagine just 2 months? Okay. Mr. Simon started seeing me in December, early December. In 2 months' time, from 10 medications, I managed to remove half. Okay, from 10 tablets to only 5 tablets per day. How many of you think this is quite an awesome experience that Mr. Simon has actually experienced? And how many of you think that you want this kind of experience? And you notice Mr. Simon keep repeating saying that, oh, I'm more energetic now, okay, and I'm happy, less stressful now. I'm eating good food and things like that. You notice these are the sharing that was shared by shared by Simon with all of us. How many of you would like to experience something like what Simon is experiencing? Please comment yes. Why? Yeah, either yourself or for family members. And how many really think that wow, this is really awesome and this is really what you want? You want life, okay, you want good life, you want an enjoyable life with as little medications as possible. Yeah, so if you are like this, all right, you are just like Simon, all right, you want to live your life to the fullest without all these medications, you want to enjoy good food like what Mr. Simon said, please comment why. Okay, let's move on.
So
So,
secret number 3 that we want to reveal is diabetic patients can stop taking medications, supplements, or even insulin.
ladies and gentlemen, just think about it. Do not think that, okay, sorry, go back to this. Do not think that this is a small little secret. Don't even dream of one day that your doctor will share this with you. Your doctors will not share this with you. Okay? I'm sorry, your doctors will not share this with you. Why? Come on, they are the ones prescribing medication to you. Why in the world are they going to share this with you? If they are going to share this with you, it's just like slapping themselves, right? It's the same thing. They are prescribing to you and telling you that you have to be on lifelong medications. They will not be able to share this with you. But now you are being empowered. Now you know it can be done. Now you heard, okay, firsthand from Mr. Simon that from 10 medications, of course, we have not completely reversed his condition yet, but from 10, it already went down to 5 within 2 months. Don't you think this is very fast? Why do I say fast? Even if it take 1 year, don't you think it's fast? You know why it's fast? Because for many, even in their entire lifetime, they won't have an opportunity to get rid of medications. And for Mr. Simon, it was 2 months to drop 5 medications. Okay, I'm pretty sure probably in the next 2 months, okay, or maximum maybe 4 months, I will be able to hopefully, okay, drop off all his medications and he will no longer be needing any of the medications. Ladies and gentlemen, just for information, Mr. Simon is also on a blood thinner, and you know this blood thinner actually causes gastric. Therefore, he is also on gastric medications. Okay, I'm hoping one day I will be able to get rid of these medications for him as well. All right. Yep. Okay. Yeah. So somebody said yes, they want to earn more money. I think at this point of time, we really need to share with everyone, and I want to plead everyone not to place any blames on any doctors. They are my colleagues. Okay. We are in the same team. We are from the medical team. Okay. I don't want you to place any blames on any one of them. Let me give you a few reasons why. Number one, the secrets that we are sharing with you we didn't learn this during medical school time. We didn't learn this from our professor, our boss, our head of department when we were in the government sector and things like that. So number one, we never learn. So it's not the doctor's fault. So number one, it's not the doctor's fault because we are not aware. Number two, even if they are aware and if they are under some employment, either with the government or the private sector, they won't be able to share with you because that is going against the guideline. Do you remember the first doctor who inspired me, Dr. Sarah Hubbard? She's going against the guideline, ignoring the guidelines. Reverse diabetes by ignoring the guidelines. We have to ignore the guidelines. We have to be very bold in what we do. If we are going to stay timid, okay, what we're going to do, we're going to just prescribe medications to you. All right, and Mr. Simon will not be where he is today because we will be no different from other doctors. So many of the doctors, they are timid and they won't be able to share this with you because they have a rice bowl they have to take care of. They need to make sure that their boss don't fire them. Okay, because they have to follow the protocol. The protocol is to increase the dosage of medication, not reduce the medication. So please don't blame them. Of course, the last one, which is also not a very nice reason why you shouldn't be blaming them. Okay, someone already mentioned it. They want to earn more money. Most doctors, okay, depend on selling medications to make money. How are they going to make money if they don't sell medications to you? In Sweet Lives, we don't sell medications. We don't even sell supplements. All right. So you have to understand this. So you cannot blame them. And furthermore, they also don't have the time to educate you. Okay. I'm not sure, ladies and gentlemen, how many of you would agree with me that many a times when you go and see a doctor, right, you realize that you are spending most of the time in the waiting area. 1 hour, 2 hours, or even 3, 4 hours sometimes. And then when you enter the doctor's room, you're only in the room for what? 5 minutes, 10 minutes. At most 15 minutes, you have to get out of the room, right? So you cannot blame them for not educating you, all right? For not sharing all these secrets with you. You just can't blame them. The system doesn't allow them to do so. So please don't blame them. And this is why we started Sweet Lives. Our system here is different. Okay, we use education to empower. Okay, ladies and gentlemen, for those of you who are still here, I really thank you. Okay, it's already 9:40. Okay, of course, we promise you we're going to end at 10 o'clock. Okay, but no stay tuned because we have more secrets that we want to share with you. All right, there are more things that we want to share with you. Okay, so how many of you agree that yeah, most of the time I call all these touch and go doctors. It's like just touch and then you go, touch and then you go. You're in the room for 5-10 minutes, you get some scolding. The doctors will usually scold and say, oh, no, your sugar is not well controlled. I'm going to add on the next medication. I'm going to add on insulin to you, okay? And you don't really understand what is going on, right? Yeah, but this is not what we do here, okay?